Welcome back to Fueling the Economy in the Face of COVID-19. With us on the line is Mr. Himalaya Boodoosingh of the National Gas Company. And we are now joined by Ms. Claire Fitzpatrick, Regional President of BP. Welcome to the program, Ms. Fitzpatrick.
Thank you very much, Wesley. It's a pleasure to join you.
Very good having you. Before you came on, I was having a conversation with Mr. Boodoosingh of NGC and Dr. Shellbillah, CEO of Atlantic, about business continuity at a time like this. What's happening on the BP end? I know there's a global perspective and there's a national perspective. Perhaps you can give us a feel for both.
Certainly. So I think you started using the phrase, this is a kind of a global storm, and I think that is sort of an appropriate thing because we have both the medical pandemic aspect and we also have a price shock. But if I stick with the medical pandemic, given that impacts people, therefore it's our primary concern, this is an unprecedented situation. And the business community has an important role to play in looking after both people, maintaining critical operations, and our role in supporting communities. So from a global perspective, much like you heard Hima talk about in January, NGC started talking with people on what might this mean. We stood up our global response team in January to start thinking through how we might respond to this on a global basis. Locally, our crisis and health teams have been working through response plans for many weeks, and we formally stood up our crisis response team here on the 14th of March. And we're very clear on our priorities of, number one, around ensuring the safety of our people, and then around what can we do to ensure the safety of our operations with a view to how do we give some security around supply, that's supply overall, but in our hierarchy it's making sure that we're protecting the supply to the island of Trinidad as a priority. So that's sort of what the stages that we have started to go through. Much like the others, I am sure we would all like to say thank you to our frontline employees and service providers as they are on our onshore and offshore sites to ensure that we are keeping the lights on. But at the very difficult time, that means they're away from their families. So I think they need to be commended for their role that they're playing in the response that we're doing. And I also think from sort of BP's perspective, I think we'd like to commend and support the government for the prompt and decisive actions that they have taken around seeking to secure the security of the people of Trinidad. So like the others, we are continuing to evolve our plans, very much looking to how do we secure our people and our operations, including what that then means for contractors and ensuring that they too are clear on what is required in terms of changes in protocols to keep not only our people safe, but their own people safe as well.
Now, even before this current crisis, there were issues regarding the market and there were issues regarding production levels. How do you see the short to medium term unfolding when it comes to those issues, given what's happening now with respect to the human resource issues and the global crisis turbulence that's happening?
I think if we start with from the people perspective, I think we've put in place steps to try and protect people as much as possible in terms of, again, as you've heard from the others, any non-essential staff are not at site. Anyone who can work from home, we have had people working from home since the 16th of March, but we've been putting in place screening protocols, monitoring protocols, isolation protocols, up to and including what we're calling a cocooning strategy, which is developed for some of the business critical operations to ensure that we can continue supply for the essential services such as power, which will hope to manage and mitigate any of the potential escalating scenarios which people are thinking their way through. So we're doing our best to make sure that we keep people as safe as possible. Again, if people are not on site, then we're strongly encouraging that they do listen and adhere to the government's guidelines around staying at home, not being out unnecessarily, the social distancing, but we're also making sure that we're communicating all of that with our contract community. So at the moment, we're seeing no short-term impact to supply. Yes, there are scenarios that we're working through which, if the global market demand decreases and there is a need to have lower production coming out from Atlantic, as Dr. Shellbillah talked about, but we're working very much to ensure that we are cocooning what is needed as a minimum to keep supply to the island. So that's what I mean in terms of how we're tiering our responses. But our primary purpose is obviously looking for the safety of our people, then the security of supply. But we are looking through both lenses. Longer term, what might this mean in terms of market demand? I think it's a fast evolving scenario, and it's one that we need to make sure that we are planning so that we're in a position to respond appropriately.
Now, Dr. Shellbillah, I suppose a lot of this is resonates quite clearly with you. Is it the same kind of posture of Atlantic? Which affected the scenarios.
Yes, it is. I must say I didn't catch everything that Claire said, but the way we've also structured is indeed such that we have looked at risk, right, and approached this on the basis of risk. So starting by recognizing the entire value chain and where there could be challenges and weaknesses in that value chain, we have then tried to put in place the sorts of mitigation that could deal with whatever different scenarios that we would meet. A couple of the things that are actually going to see us through this are a rigorous prioritization of our activities to ensure that we're focusing on the right things during this time. We're also focusing a lot on finding new ways of working and new ways of doing things that are different from the past. And, sometimes they say necessity is the mother of invention, and we've definitely seen our staff just blossom in the area of technology and in finding creative ways of doing things. The other one is just in exercising very robust financial discipline at this time. And these are the things that we think will see us through the challenges that we're facing at the moment, aside from the actual activities that we're implementing on site, such as thermal scanning that we're now doing on our site, applying questionnaires to manage those coming onto the site, and the social distancing as well, even of our operators on site.
Mr. Boodoosingh, the technological response, the remote functionality of the operations of NGC, what you say about that?
Yeah, I think this has been a really good opportunity. You never really waste a good crisis, is a saying that I've heard a lot in the energy industry. NGC has found really creative ways of getting things done as well. As Phillip and Claire mentioned already, I think it's from the technology standpoint, one of the, maybe I'll make 2 points around that. One is just a bit to talk about using technology in the form of redundancy. We do have multiple control rooms that exist at different facilities that are scattered across Trinidad and Tobago. One of the things that we have done is actually created a system where we can operate facilities remotely from one of the other control rooms. So if for any reasons one particular control room isn't accessible, it can actually be operated remotely. And we've tested that outside of these scenarios. Last year I actually witnessed that being tested during a flood scenario where remote monitoring and operation was conducted. So again, that loop-in increases the level of reliability for us to ensure that safe and reliable delivery to customers. The second one, and I really have to offer congratulations to my own team at the NGC, because within a couple of days they were able to quickly turn around a solution that allows persons to hot desk in from a remote location. Well, one of the challenges we had at the NGC was how do we get folks who work with a desktop machine that's difficult to take home in such a short scenario, the guys were actually able to deploy a solution that allows them to remote in from their own personal machines at home, and tested that within a couple of days, and it worked beautifully. So we're actually seeing the benefits of that right now.
Mr. Boodoosingh, we covered this a bit with Ms. Fitzpatrick and Dr. Shellbillah regarding the scenarios. In terms of the scenarios that are being envisaged by NGC, what is the thinking short, medium, and long term?
Yeah, I think from a scenario planning standpoint, we actually started looking at this back in January, looking at various stages of escalation and what would our response be to those sort of challenges that we're faced with. I think Trinidad has been fortunate in some regard. In that maybe we did have a crystal ball. We just needed to look at what's happening around the world where this actually started and started spreading, and looked at the challenges that those countries and those communities face. And, we started asking ourselves the question, how will we respond when this gets here? It's not a matter of if it got here, it's when it got here. So we started looking at various scenario levels. We operated for, a couple of weeks with no cases in Trinidad. The next scenario we looked at was when the first case came to Trinidad and what we do differently, and we actually kicked in those plans. We looked at local spread, which is slightly different from the community spread. So we looked at local spread level clusters, then we moved to community spread, and our actual last stage of planning, which we are getting ready and geared up for now, is in the event that there are further restrictions in the movement of personnel through a state of emergency type of scenario, how will we respond? We do see and hope that the measures that the country and the authorities have taken thus far should prevent us from getting to that scenario. But in the event that we do get to that stage, we want to be ready to actually respond. One of the things that we're starting to do right now, and maybe even thinking about implementing prior to that, is actually looking at putting our operators, our critical operators, in quarantine, so that they're actually we see actually changing shift as a big threat to us, where there is the potential to import a case into the control room. We do want to keep the control rooms as pristine as possible, so we're looking at getting ready to implement that level of response even before further restrictions come in place. So we've looked at sort of 5 levels of response, and we are, like I said earlier, we're trying to stay 1 or 2 levels ahead of that in terms of our readiness.
Ms. Fitzpatrick, as a global business, how are the other operations elsewhere in the world being seen as providers of best practice models and in turn sharing of best practices throughout the world in the BP chain?
Within sort of BP globally, then there is daily communications between all of our sites, no matter which bit of the business people are in, so that we are learning from each other and sharing best practice. So that's a routine part of how we operate. And we're also then sharing where people are learning things that are more successful than others, and also just learning where techniques have been more successful than others. So you mentioned, you heard Hima there talk about looking around how do they quarantine key staff to try and make sure that they can have the key control room staff be able to continue to work without contracting the virus. That is something that we have already implemented around what we refer to as the cocooning strategy for our business critical operations. And that was something which not only here in BP in Trinidad, that's something that we're actually looking at doing where possible in many locations. Now, it's not necessarily something that is possible for every location. It very much depends on their circumstances, but it's something that all locations look at in terms of how do you, again, as Hema said, the more you can reduce crew handovers, then the fewer opportunities there are to actually have transfer. That's also something we're looking at even for when we are taking crews off site. We're making sure that each of the sites crew change on a different day so that we also isolate who's actually physically moving between sites and shore, to again try and introduce another layer of protection to minimize the risk of spread.
Now, Dr. Shellbillah, I suppose a lot that is very familiar to you, but the variety of service providers and other stakeholders may or may not be wider in scope than when we speak about BP. So the safety issues, the health and safety issues might have broader application in the case of Atlantic. Is that so?
Well, I think there are lots of similarities from a health and safety perspective right across the industry. However, there are one or two instances, for example, where we have done certain things just to try and mitigate some risk. So take, for example, when the LNG ships come, jetty side for loading, typically we would have a number of our employees boarding the vessels in order to interact with the captain and his crew, get some forms signed and so on. Since this pandemic, we have been able to get an intrinsically safe tablet that we actually rig up to the vessel. It has all of the forms on it. The captain and his team are able to have a call via Teams with our control room, and we don't have to send our staff up there. So talk about social distancing being mitigated by technology. That's an example. If you look at the way I see this pandemic is when it is over, I think very few of our companies will be left the same. One of the things we've started doing is electronic signatures, as an example. That is something that we've been trying to do in order to get to a paperless system. And we've kind of struggled with it. And now we're in a situation where it is mandated. We just have to do it. There isn't a choice. So there are a number of things that we're doing which have an impact on health, safety, as well as the environment, talking about a paperless system, which have been triggered off or accelerated by the pandemic coming upon us. Okay,
Mr. Boodoosingh, you're going to have the last word, just a few seconds, in terms of the legacy issues and the human safety issues.
I think from a human factors perspective, I think we do need to recognize that this is a new territory for all of us. I think Phillip mentioned 1 in 100 years type pandemic in his opening context. And I think a lot of our critical staff that is working sort of behind the scenes, silent running, making sure that we can enjoy the things that we're enjoying right now. There's a lot of stress on these guys, and I want to recognize that we have been working with our providers to ensure that personnel recognize the need to stay fit, not just physically but mentally during this very stressful period. Okay. And I just want to recognize the fact that there are a lot of workers, energy heroes that are silently running all of these organizations that's making all of this happen, and I want to thank them for their service.
We have to leave it there, unfortunately.